In 2016, 528 people died from an opioid overdose in Colorado, representing a continued rise in our state. A hospital in Denver has seen this crisis firsthand.
Even as late as 2015, when we know opioids are a problem, and we know tens of thousands of Americans are dying from opioids, still, dentists and doctors prescribed 1/3 of Americans an opioid. That is amazing. Opioids are the most dangerous type of narcotic that exists in terms of how addictive they are, how punishing they are in overdose, and how rapidly patients develop addiction to them. So they're really a dangerous class of drug that we've relied upon too heavily for too long. And we have to change things if we hope to save lives.
In the small town of Wellington, Colorado, Josh experienced how quickly an opioid prescription can escalate to an addiction.
For my knee surgery, the serious one, I had three bottles of 60 of 5 milligram oxycodones. So that's like a lot, but I was also in like the worst pain I've ever felt in my life. Ended up getting my wisdom teeth pulled, and I had got such a tolerance to it that having that surgery made me abuse them more because I was in so much pain. And so then I was really abusing them, and ended up quitting my job because I had to have another knee surgery, and that didn't help at all. And then from there it was just downhill, just surgeries, and I guess not the right information on how addictive they can actually be.
Sometimes opioid addictions begin in the most unlikely of places, even after a simple dental procedure.
Dentists are usually the first prescribers of an opiate to a teenager. When we take out their wisdom teeth, we usually give them a prescription to manage their pain for 2 to 3 days, and sometimes longer. And there are studies that show if a teenager is prescribed over 3 days worth, they have a higher propensity to become an addict. So we want to limit that and be real careful with our prescribing habits. How do you know if you're providing safe prescriptions or if you're overprescribing? And we have to manage our patients' pain, and that's really important. And from a dentistry standpoint, if something, sometimes things don't go as planned and there is some extended pain, and so we have to kind of assess the situation, and I do that by actually seeing the patient and seeing what's going on, and if there's a simple cause, we can fix that cause, doing a procedure.
So I realized there's a problem with opioids in this country around 1.5 years ago, and I can isolate it back to just a particular patient. I was working in a freestanding emergency department, and a 21-year-old young female patient had overdosed on heroin, and she came to our doors. She was blue, she was apneic, she was on really the brink of death. We gave her a life-saving medication called Narcan, or naloxone, which brought her back to life. And for 2.5 hours, she was the only patient I had in my emergency department, which was pretty strange, but it is a freestanding emergency department. So I went back in and I actually started speaking with this young lady. And I asked her questions which I really hadn't asked my patients who had overdosed in the past. I asked her how she got into heroin. And what she said to me really knocked me on my butt. She said, I got my first prescription and my first high off an opioid, off an emergency physician after I came in with a sprained ankle. And the reason why that impacted me so significantly is because earlier that day, I had written someone for Percocet for a sprained ankle. So it kind of drew a direct line between how I was practicing medicine and the really detrimental effects that can have on patients. The ALTO initiative stands for Alternatives to Opioids. So ALTO is a new approach to controlling pain that really emphasizes non-opioid pain treatments over opioids for all types of pain. And what it is, I'd say at its base, is a revolutionary approach to medicine and to how we approach pain, especially in the area of the opioid epidemic. I helped write the guidelines for the Colorado ASAP guidelines. Colorado ASAP is the American College of Emergency Physicians. And we came out with guidelines in 2017, which were among the first in the nation, to propose that ALTOs be used for the primary treatment of pain. Some of the alternatives are going to be really familiar to people. Things like Tylenol and ibuprofen. And I'm going to go on a little bit of a tangent here. Tylenol and ibuprofen, there was a recent study that said that those two medications in combination are as effective as giving someone a Percocet or a Vicodin for a fractured bone, right? So wow, they're as effective as that. So some are very familiar to our normal patients. Other ones are very unfamiliar. Things like Toradol, which is an IV form of ibuprofen that's almost, I'd say, 5 to 6 times as strong. It is a really amazing pain medication. Other things that we're using are lidocaine, the same thing that your dentist used to numb your teeth. We're using inpatients' IVs in order to numb nerves that are causing pain. We're also injecting it all over the body. So if you come in with the lower back that's hurting, and I'm pushing on your lower back and you're having a significant amount of pain, why don't I just grab a needle, put a needle in there, numb that whole area up, and let's get rid of that pain right away.
I grew up with addicts. Both my parents are alcoholics, and it was like I should have seen it coming and known the progression stages of it, but like didn't see it coming at all. I started using heroin after a while when the pills weren't cutting it anymore and they were too expensive and they weren't doing it for me anymore. I had to go to something cheaper and more potent. I didn't have to, I did, and it was actually on my 21st birthday a year ago this month that my drug counselor sister just looked me in the eye on my 21st birthday, and she asked me if I was high on anything, and I lied to her, and she knew I was lying. And then kind of just all fell apart from there, and so we ended up not doing anything for my 21st birthday, and the next day they checked me into detox.
Doctors are using ALTO protocols in 11 Colorado hospitals, reducing opioid prescriptions up to 45%.
There's plenty of examples where a person really needs or really can benefit from opiates, and the ALTO study does not try to discriminate against people who truly need this, but we're trying to use alternative treatments for things where maybe they really don't need it. For example, migraine headaches or chronic back pain, kidney stone pain, abdominal pain, things like that. If somebody came in with a migraine headache, well, back when I trained, you'd usually give them a big shot of an opiate pain medication and a big shot of an anti-nausea medicine, and it would essentially put them to sleep. But the problem was that not only would it treat that headache, but sometimes it would predispose them to more frequent headaches. And then more frequent headaches would lead to more treatments with these opiates and then addiction. I'm really glad that the opiate crisis is becoming a common term in the general public, and we're trying to make a positive impact and change in the opiate prescribing practices here in Colorado.
Like I told myself, like in detox, that like if I ever wanted to do it again, like I'd rather honestly like die than become addicted to opiates again.